office, we offer both semaglutide and tirzepatide. So what are these medications that everybody's on and everybody's talking about? Well, most of the time people are using them for weight loss, but really they are diabetic drugs. So they're used to lower your hemoglobin A1C and to help support your insulin. So the main things we use this for at our office is not only to help diabetic and blood sugar control, but also for cardiovascular benefits. We know if you lower your blood sugar, then your cardiovascular benefits, such as lowering blood pressure, having better cholesterol readings, a lot of these things are actually linked to tirzepatide and semaglutide. So it's not just a diabetic medication. Overall health is great. We know that it has some hormone balances. I'm sure we've all heard of like the Ozempic babies and increasing fertility. So there's many different uses for these. And again, weight loss is a byproduct of all the health and benefits that you get from these. A lot of times people try them at least for a good 3 months to see where their weight loss is. But first you're starting off with one shot every single week at a very low dose. Your body can get used to it. You don't want to start off very high because the main concerns that you can experience are nausea and some constipation. So you start off low, get your body used to it, and then every month you can go a little higher until you get to your desired weight and desired blood sugar level. So the weight loss at the beginning isn't very substantial. You're really doing it for health. You're doing it to regulate your blood sugar again and to help your overall panels on your blood work improve. And then as you get higher and higher in the doses, the weight becomes a little bit easier to get off for sure, but side effects also increase the higher the dose. So it's a balancing act that you would do with your doctor to make sure that it's working for you and that you're doing well with it. And the doctor is telling you all the side effects and everything that you need to know. So we specialize in this at our office. I see a lot of patients that do very well with semaglutide or tirzepatide. There are two different medications. They're metabolized two different ways. So sometimes people do better with one versus the other. So this is how I can go through this with you and see what the best dose and the best medication would be for you to take. But I've seen great benefits with it. I think that people are doing better than they ever have, especially if you have stuck weight or you just don't have that motivation to just make those changes. I find once weight starts coming off people, they feel way more motivated, they get back into their exercise, they can regulate their portions much better with their food. It just changes their habits, and that's something that long-term will stick to them. So this is something you don't have to do long-term or do forever. We want to have people change their lifestyles, change how they're eating, and use this medication sometimes for people to actually just as a kickstart for their overall health.